Hi, everyone. I'm Keith Brown with Perry Local Schools. I teach at Perry High School, and boy, there are so many good stories going on right now as we go through these uncharted waters in a new time. And I'm just trying to get them all together so we can share them. So I have got a special guest with me today. This is Lori Howenstine with the Perry Medical Academy. She's the department chair and one of the teachers there. And how you doing, Lori? Good to see you.
Good to see you too, Keith. I'm doing great. Thanks for having me on.
Oh, you're welcome. So I heard some students, not some students, I heard some stories about the medical academy and a whole bunch of people around you donating stuff to some of the hospitals. So I wanted to talk about that. I got a few questions for you. Let's just start with this PPE thing. That's a term we're getting thrown around a lot. What is it, and what are you doing with it?
Well, PPE stands for personal protective equipment. And if you've been watching the news, you can definitely tell that there's definitely a lack of it right now. And hospitals and caregivers definitely need as much PPE as they can get their hands on right now.
Okay. Now, personal protective equipment. So I see why they go PPE now, way easier.
Right.
Tell me about goggles, gloves, hair caps, mask, all that Perry has been able to donate to local hospitals. Tell me what's going on with that.
Well, that is correct. So right after school was shut down for the first 3 weeks, the Medical Academy, we pulled all of our personal protective equipment, our PPE out, and looked at what we wouldn't need for the remainder of the school year, and we delivered that to Altman Hospital and Mercy Medical Center. And then after Governor DeWine shut down school until May 1st, at that point, we decided let's just go big. So I reached out to Marcy Herstein, the science department chair. Rebecca Silla reached out to Becky Embley, and we collected all of the PPE in the district, and we came up with a lot of help for not only Altman and Mercy, but also for Perry Township Fire Department and for Perry Police.
Well, and that's what we're finding out with all these stories. It's not just the schools, it's the community and how we're supporting each other. Now, I'm just going to mention a few things, but I'm going to put right down here across the bottom of our video, I'm going to scroll everything that we have already donated. We're talking face masks, gloves, goggles, gowns, hair processing caps from cosmetology, cotton-tipped applicators, and so much more. So everything is just being put out there. So what specifically are they looking for? Somebody from the community wanted to help out. What is something they could do?
You know, probably the biggest things are masks, face masks right now. That is the one item that they're desperately in need of. So if you have any type of face mask that you have, maybe even the kind of ones that you use to paint with, just to cover your face, anything to help block the flow of the moisture particles coming out of the mouth and nose in that way. And it's even something that can be handmade as well. So they are looking for all different types of things in regards to covering the face. Gloves, they go through a lot of gloves, and any kind of medical supply they will take right now.
If somebody can make those or do those, then what do they do with them? Just get them to the hospital? Is there a drop-off spot? What do you know?
Well, if you go to both Altman Hospital's website and to Mercy Medical Center's website, they each have a different initiative on making homemade face masks. So if you're handy with a sewing machine, there are CDC guidelines that can help guide you through that process. And Mercy Medical Center is part of that 100 million mask initiative. And if you go to their website, they will direct you to the patterns and everything that need to be used, and also where to take the masks once you've completed them.
Awesome. And we're going to add a bunch of those links in our posts on social media too, so people can just click and link. Now, you had one. I saw it. Where's it at?
It is right here, but this isn't, I don't sew. I wish I knew how. I wish I had a sewing machine, but I don't, because I'd be making them like crazy right now. But this is just really a bandana. And if you go on YouTube, you can learn how to fold one where you can use 2 hair ties and a bandana, and it works really, really well. So I've been using that out in the community, and it's a great way just to make one on the fly.
Okay, yeah, that's right. So that's ones we could use for ourselves as we go, if we need to go outside, right?
Exactly.
Good.
We don't want to use the face masks that the medical professionals can use. We want to be making our own right now for us.
Awesome. Now, and I think it'd be good to talk about the like the amount of gloves and masks that these hospital needs is phenomenal.
It is.
So, and that is why the call is out there for people to help. I just saw a story, I read an article recently, like one person getting treated for this, we're talking maybe 30, 40, 50 pairs of gloves per day for that one patient. Does that sound about right to you?
Yes, that's right. For every time a caregiver steps in the room to draw blood, one set of gloves, use them, they get thrown away. If any other procedure, one set of gloves, throw away. There's more than multiple people caring for that patient, and the more involved that patient, the more gloves. So it's definitely an item that gets, you can't reuse those.
Yeah, right. Okay, that makes sense. Now, what can people do? Well, even before I get to that, you have EMT skills, is that right?
That is correct. I'm an EMT basic.
Now, are you able to help out, or do you want to help out? How's, like, in a hospital, what have they asked like medical people to do with this?
Well, if you're not part of a current hospital system or a current fire department, EMS service, or anything like that, last week, the Ohio Department of Health, Dr. Amy Acton put out a directive that to start to basically catalog all of the medical providers in the state of Ohio, not only EMT, but nurses, doctors, respiratory therapists, physical therapists, occupational therapists, et cetera. And they want to know where you are, and they wanted to know, are you willing to help when we get the surge? So it's by choice, but I got my email last week and I filled out my form, and I am ready to step in if I'm asked to do so.
Oh, incredible. Now let's talk about what can people who who don't have medical background, what can we do to help flatten the curve? Give us your best advice here, because we know right now preliminary results say it's working based off of the latest thing we saw through DeWine, but tell us more so that we can get past this faster.
Yep, exactly. Don't let up is the biggest thing I keep on hearing. Stay home. Stay home, stay home. If you have to go to the grocery store, pick up medicine, try to consolidate those activities in one outing, so that way you're not going out multiple times. We could be infected and we don't even know it. There are asymptomatic carriers, and that's why the face mask. That's why we need to protect each other from this very aggressive virus. So boom, stay home. 2, wear that mask in public. And help others. If you have the ability to make masks, help out our hospitals and your neighbors by making masks. Continuing to wash your hands and using hand sanitizer, and then also cleaning and sanitizing the surfaces that you touch often. So think about, if you go to the grocery store, how many packages you touched and everything else, the doorknobs, the handles, and then you go get into your car and you touch surfaces in your car. So think about what needs to be cleaned so that you can continue to protect yourself and your family.
I find myself, and I probably was doing it before, but how much I touch my face, and now I've got to stop doing that. I got to remind myself, stop doing it, or I grab my chin or something like that, and stop doing it. So, oh, wow. Thank you. Hey, thank you so much, Lori. Again, we're going to add a bunch of website links on here so you can be part of helping, be part of shaping our community and supporting our community. Thank you, Lori, for being a leader and helping out in so many ways. We just thank you so much for sharing your story today, and how we can help and how we can get past this even sooner. So thank you so much, and have a great day.
Great. My pleasure, Keith. Thanks for spreading the word.